Morning.
Good morning.
Hi, so if you just want to introduce yourself to the students and tell them a bit about your role in the company that you work for, please.
Hi, yeah. So I'm David Henson. I'm a lead cardiac physiologist at Kingsmill Hospital. So what we do as physiologists is quite varied and quite dynamic. So we start off our career doing simple things like ECGs, and then on to doing things like ambulatory monitoring, where we monitor people's hearts for 24 hours and then have to analyze the data from that. Moving on to more advanced things like echocardiography, which is something very similar to what they do to pregnant ladies to have a look at babies, but we do it to look at the heart. And then on to helping doctors fit stents into people when they're having heart attacks, and even helping them put pacemakers into people and ICDs inside them. And then we look after those people with the ICDs and the pacemakers afterwards as well.
Can you go into a bit more information about what ICDs are and pacemakers and what they do?
Okay, yeah. So an ICD and a pacemaker, they start off basically the same. So they're all pacemakers. So pacemakers stop the heart going too slowly. And that's all they do really, in a nutshell. So if for whatever reason the patient's heart wants to go slowly, and then that can cause them to fall over and damage themselves, we put a pacemaker in them, and that prevents that from happening. They have little clever tools in them which allow the patient to exercise, and it will pick up on the fact that they're moving around doing exercise, and it will the heart rate accordingly. But in their essence, they just stop the heart going too slowly.
Okay.
Now, an ICD is the next step from that. So that also stops the heart going too quickly. So we've all seen the defibs on TV when they grab the paddles, careful to stand clear and shock somebody. Well, this is the same thing, but inside them. So it's like having somebody walking around with a defib behind them all the time. So should their heart decide to go in a silly rhythm, which is life-threatening, it will shock them and bring them back to a proper rhythm, which basically saves their life.
Yeah, wow. So how do you fit into the organisation in terms of your kind of role?
Okay, well, the physiologist is a bit strange. We don't fit into the normal hierarchy. So where you'd have, usually you think of nurses and doctors and then consultants, we kind of sit on the outside of this. So we are as well trained as any of the doctors. In fact, the consultants often come to us for advice, but we're not actually a doctor. So we kind of fit somewhere in the region of a very highly qualified nurse to maybe a registrar as a doctor sort of area, but we're not actually part of the hierarchy.
Okay, so in order to get to your position, what kind of career path did you take in terms of education and just becoming a physiologist?
Well, I'm well old and I've been doing this job for about 26 years now. So anybody that can do maths, I started when I was 10. But when I started, there was no such thing as degrees in physiology. So I went through an ONC and a HNC, which I did part-time while working in a department, and went through basically what was then what would now call an apprenticeship. So that's the route I took. I gradually then worked my way up through the career, through the departments, and became, as I am now, the manager of the department. So there's no reason why you can't start from the bottom and work your way right to the top, as it were. The today's route is very similar. There's two ways of getting in. You can come through a degree route. So there's an STP or a PTP, which are both courses which you can take to become a cardiac physiologist or a cardiac scientist. Or you can do the apprenticeship route, which I really prefer. So we pay people quite a nice wage and pay for their degree as well. And they take their degree part-time while they're working and earning.
That sounds like a good route. So what made you get into this profession?
Unfortunately, rather like everybody else who came to this profession, because we always say we're the sort of the Cinderella of the NHS. No one's ever heard of us. So we all fall into it, and we usually come into it by accident. So for me, it was a case I saw a job advert in the local paper and thought, wow, that sounds interesting, and gave it a go. A lot of my staff have come in through sports science degrees. So as part of their sports science, they've done placements in hospitals or placements in physiology where they've really enjoyed it and got to know what we do. So most people have done it by accident.
Okay. So did you always have an interest in science and the heart? I know you say you stumbled into it, but I guess there must have been an initial interest somewhere down the line.
Well, my interest came really from well, I suppose it would be from my physics teacher
Okay.
a long time ago. Originally I wanted to be an accountant. Not quite sure they could have put it with my sense of humour, but my physics teacher persuaded me to go into science, and I followed that route through physics, through that route into this job. It's a real good blend of physics and biology. So if you're interested in either one of those two, it's a great job to have.
This is just me asking out of interest. Where is the physics element of it? I can see the biology element, but the physics
Okay.
element isn't obvious to me.
Right. Okay. So, well, when we're dealing with echocardiography, that's ultrasound. So we have to know all the physics about how ultrasound works, because unless you know how it works, you don't get the right pictures. All of our function of the heart is physics. So you've got the pumping of the heart, you've got pressures, the fluid dynamics of all that, which we use fancy equations. We don't do it by hand nowadays, but we have to understand why they work and how they work.
Yeah.
And when it comes to the pacemakers, they're all electronics. They're basically mini computers. Okay. So it's all the physics of down to simple V equals IR. When we're testing the leads to make sure they're physically okay, we're looking at the impedance of the lead. And if that goes up or goes down, it tells us what's going wrong with the pacemaker. So yeah, it's very physics based.
Yes, of course. See, now you've said it, it seems obvious, but it didn't seem obvious until you explained it.
Exactly. It is a very strange career. We are a bit of a weird lot.
Yeah. So what does a typical day kind of look like for you?
Well, for me, unfortunately now I'm managerial. I tend to spend an awful lot of time in my office, which is not great. It's really bad for the waistline. I spend a lot of time in meetings. I help run the department, so I'm looking after the staff, and I'm doing very little in the clinical world, which is a real shame because I do miss that. The reason we're all here is because we enjoy dealing with people and we dealing with patients. So actually being in my office isn't great, but looking after staff is kind of like my looking after patients now. Mm-hmm. But for a normal physiologist, they would start some sort of time around about 8 o'clock in the morning. They would probably either spend the day scanning people, so they'll be doing the ultrasound scans on people. They could be in the catheter lab helping doctors implant the devices, or they could be analysing ECGs on a screen from 24-hour tapes to have a look, see what's going on. So it's quite a varied day. No day's the same at all. And at some point, you can end up being on call. Now, if you do that in a tertiary centre, so that's a big hospital who deals with all the fancy stuff, we do something called a primary PCI. So that's where we put a stent into somebody, which is kind of like a little bit of a scaffolding you put inside the coronary artery to hold it open and stop somebody having a heart attack. We do that while they're having the heart attack to try and stop it from happening in the first place. So that's usually done in a rush. It can be done at any time of day or night. So we can get called at 2 a.m. to rush into hospital to go and do this and save someone's life. So it's a really varied job.
Wow, okay. So have you got any kind of tips for people who maybe want to pursue a career in your kind of field?
Yeah, just get out there and be enthusiastic. One of the biggest things we need is people who actually want to care for people. And that's really important. I always say I can train anybody to do cardiology. That's not an issue. What I need is people that really want to care, and that's the key. So just because, like myself, I'm not academic. I never have been academic. I mean, I might have a qualification equivalent to a master's, but that's by fluke. The important thing is you care. And if you care, follow that dream and push yourself, because you never know how far you can get. Look out for the apprenticeships. Get in through, I've got a member of staff at the moment who came in through A levels. So she finished her A levels. University wasn't for her. It wasn't what she wanted to do in life. And therefore she came and joined us, and she's now doing a degree and doing very well at it, being paid to do it, and enjoying all the thrills and spills of cardiology along the way. So as long as you care and you want to care for people and you have that enthusiasm to learn, not necessarily, I say, at full-time degree level, but as long as you've got that enthusiasm to learn and want something new in life, go for it.
Okay, so basically what you're saying is you don't have to go to uni in order to do a job like yours, which I think is a massive misconception, that you must go to uni.
Yes, yeah, absolutely. It frustrates me quite a lot, because some of the best physiologists I know, and some of the best doctors really, didn't start off in that career path.
Yeah.
The best physiologist that I ever knew actually started off as a receptionist, and they decided that one day, actually, I didn't want to do all this paperwork and greet people. I actually wanted to help them, and they then trained to be a physiologist. So yeah, just because you may not think you're academic, just because school isn't for you, which it isn't for everybody, doesn't mean say you can't go into these sort of careers. There are other routes to take which you can get you there through, and as long as you've got your A levels, we can take you through the routes and work your way through into physiology.
Amazing. That's
Even if,
really good.
and even if you don't, I've got students now that actually start off with nothing, that they come in as assistants. So they start off as what we call a band 2. So it's at the bottom of the range, and they've taken the time. It takes a lot longer to do, but you can do it. So long, again, you've got that enthusiasm to want to learn. And they've gone through and they've taken qualifications along the way. And now they've gone into the degree courses, the apprenticeship, and now they're working as a physiologist. So they've started real rock bottom without even the A levels. There's always a way through. You've just got to look for it.
Mm-hmm. Would you have done anything differently throughout the course of your career? I know you said you wanted to be an accountant initially. Do you ever consider that?
Crumbs, yeah. Would I have done anything differently? Probably not becoming a boss. It's, I used to have hair and it used to be black. But no, I really wouldn't. I've enjoyed my time through the physiology world immensely. I started off wanting to be an accountant. I went into ecotoxicology for a couple of years, did a couple of A levels while I was doing that, which got me onto the course about to do this. But no, once I became a physiologist, I never looked back. It's one of those jobs whereby you learn constantly. Say I've been doing it 26 years, I'm still learning.
Yeah.
Things still change. Cardiology is such a young science. To put it into perspective, cardiology has really only been going since about the 1940s, 50s. So not long at all. It's within our life, well, within a lifetime, really.
Yeah.
People can remember it not being there. So back end of the Second World War, we were operating on people taking out shrapnel from the chests. We found that actually we could sew up the heart and people survived. And that's where it started. Until then, we wouldn't operate on the heart. Bizarrely, people used to think that's where your soul was kept. So if you damaged the heart, you would damage somebody's soul, so they kept away from it. Even up until the end of the 1960s, when the first heart transplant happened, people were still arguing whether we should do it, because you might start loving somebody else's wife. Because and these were eminent people. These weren't normal people. These were highly educated people who were thinking like this still. So you can kind of put it in perspective. Cardiology is very, very new and therefore growing quickly.
Wow. So have you got any kind of resources that maybe the students can take a look at that will help kind of maybe make them make a choice or just learn that little bit more?
Yeah, I can certainly find something out. We do not at the moment, unfortunately, but we do work experience, so people can come in and have a look and see what we do. We certainly can get some sort of pack together to let people see what we do as well. Always look online. If you look at the cardiac physiology online, if you Google that, there's lots of information about us out there. and cardiac sciences as well. So the information is out there, but you do have to look for it, because we are a very strange set of people and we're not known about.
Amazing. Thank you so much for speaking to me about that. It's been really, really interesting. I've learned stuff myself.
I love it. As long as we can get people to know what we're doing
Yeah.
and to encourage people to come into it. We are nationally short of physiologists,
Okay.
and we're very well paid for what we do. We're a little secret for the medical profession. If you're interested in looking after people, you're interested in caring for people, you don't particularly want to be a doctor or a nurse, then come join us, because we're as well paid, if not better, and we have a right ball.
I feel like you've sold it to me.
How would you like to start?
Thank you so much for speaking to me, David.
No problems at all.
See you soon. And I look
Please.
forward to the resources.
Thank you. No problems at all.
Bye.
Bye bye.